we will be talking
No,
about
no, 1 minute, 1 minute, 1 minute. Ma'am, we are live.
good afternoon all. Today we will be talking about rheumatoid arthritis and its impact on pregnancy. I would also brief on its impact on infertility prior to this. Overall, to know this whole month, we are providing information and awareness about RA, and particularly arthritis. Very importantly, why it is important in pregnancy and by what is its role on infertility plays a vital role, because most of the women in their reproductive age group are the ones who gets affected because of this. Now, RA and fertility, there are many reasons why it has its role over the particular reproductive cycle of a woman. Rheumatic arthritis is a condition where there's chronic inflammation of the joints, which we have been educating over the past 1 month. But its role on infertility actually plays a very important role. So the first one being its role on the hormonal cycles. The hypothalamo-pituitary gonadal axis is what gets disturbed because of the chronic inflammation. So here what happens is, because of this chronic inflammation, the normal HPG, that is the hypothalamo-pituitary gonadal axis, gets disturbed, which can lead to reduced ovarian reserve as well as anovulatory cycles in women. And in men, it can lead to erectile dysfunction as well as reduce in the serum testosterone level. And another important thing is the medications that we use for treating RA in the form of NSAIDs, athwa DMARDs or steroids. Now, NSAIDs has its role on ovulation also, as well as on implantation of the embryo. DMARDs and biologics are the ones which are mainly can reduce the production of the sperm. And steroid overall has an impact on fertility. The third reason could be because of the physical limitations which the disease causes, could be one of the reasons why it prevents or reduces the fertility rates. Now, so basically, we will be talking about the RA and its various roles on women's cycle and how it impacts, or how is it going to take its course during the course of pregnancy. So arthritis per se mainly affects women in the childbearing age group. And that plays a vital role because that is the time where she is planning her family, and especially the ones who are taking medications who have active disease. In many women with RA, disease actively improves during pregnancy. So most of the time when I see patients in the OPD, also kind of reassuring them, saying that uh, first of all, the best state would be when the disease is inactive, and second of all, there is a high chance that the disease kind of uh, reduces its symptoms during the course of pregnancy, as pregnancy by itself is a immunosuppressive status. So, however, in some women with RA, there is a flare, and especially the ones who conceive during their active phase of the disease. Thus, it is very necessary to change or modify the treatment for RA during the course of pregnancy to control the flare and to minimize the risk that the arthritis can cause on the fetus which is growing inside. So, many changes in the immune system occurs during a normal course of pregnancy. These changes enables a fetus to grow and develop. Some of the changes that improves the RA or the symptoms of arthritis in pregnancy would be the disease activity during pregnancy. And approximately 50 to 60% of the women with RA notice an improvement in the RA signs and symptoms during pregnancy. The decrease in disease activity generally starts in the first trimester and lasts through the course of pregnancy. But unfortunately, we cannot predict which patient will get better and which patient will have a flare. It is sometimes difficult to distinguish also between the common discomforts during the course of pregnancy and the symptoms of RA as such. Pregnancy discomfort similar to RA, and now it becomes, some of them, it becomes difficult for us to distinguish, is it the RA which is flaring up, or is it pregnancy symptoms which is causing the discomfort. So the normal discomfort in a pregnant patients would be a fatigue, swelling of the hands and legs and ankles, joint pain, especially in the lower back, shortness of breath as the baby is growing, numbness or pain in both the hands. That could be also carpal tunnel syndrome, which is very common in pregnancy. Now, talking about pregnancy outcome per se, research show no increase in stillbirth or miscarriages in a woman who has RA. So, however, some medications, particularly high dose of steroid, may increase the risk of having smaller than normal child, and may increase the risk of premature rupture of membrane. And women with very active diseases during pregnancy are at risk of having a smaller baby or premature delivery. Now, what are the cares? Now, after knowing how it is going to flare, or will it flare? As I already said, it is unpredictable. Now, what are the cares that we have to provide before pregnancy? Women with RA should discuss their desire always. It's always suggestible that she has to discuss about the desire to become pregnant with arthritis when she's being treated by a rheumatologist. And obviously there will be a round of counseling which they will provide, and a thorough evaluation of the present condition, and an obstetrician involvement to explain how the pregnancy is going to go ahead. General recommendation that we usually apply for all women who are considering pregnancy um, will always be there. But in addition, a woman who was having arthritis, a woman taking prescription or non-prescription by the healthcare as to is it safe during pregnancy? Can it be taken? Can they plan pregnancy? Some medications are safe during pregnancy while others are not. In some cases, an alternative medications will be prescribed when the desire of pregnancy is expressed to the rheumatologist. Women who take methotrexate should stop it at least 30 days before trying conception. Although the manufacturer suggests the medication has to be discontinued 3 full months prior to planning pregnancy. And women, especially the ones who are taking lithium, must stop it at least 2 years before they try to conceive. Unless a course of treatment is, this becomes, I'll tell you why it becomes essential is the women in childbearing age group, their potential of developing complications in the fetus. So it becomes very essential for these medications to be stopped prior to them planning pregnancy. Most of them come to us and ask, am I ready for pregnancy? It is common for women with long-standing medical problem to be worried about their health. Will it affect the pregnancy, the child which is growing within them? Women with arthritis during pregnancy, but then they may have worsening also patient mentally, and suggest them of lack of sleep, fatigue. With the obstetrician and rheumatologist should be provided for not just the patient, but I would suggest to the entire family and friends. Now, arthritis treatment during pregnancy, we have to be very careful. There are some women with arthritis have diseases that require treatment even during the course of pregnancy. Additionally, some women with arthritis may flare during pregnancy. However, we don't have the liberty of using all the medication in pregnancy. So it is very important that the medications that they take is monitored continuously. Apart from this, rheumatoid arthritis after delivery is a big question for most of them. That is, approximately 90% of the women with arthritis experience a flare during postpartum period, usually within the first 3 months, and particularly after a woman's first pregnancy. So what they have is usually there will be the pain, the swelling, the inflammation increases a lot. Breastfeeding and RA are usually what happens in postpartum period. It is a common time for a woman with RA to have a flare of the disease. So it is difficult to know if the breastfeeding further increases this risk. However, there are numerous benefits of breastfeeding both for the woman as well as for the infant. For these reasons, the women with arthritis who want to breastfeed are always encouraged to do so. So during the course of breastfeeding also, the short acting NSAIDs can be used. A low dose of aspirin or prednisolone can be also taken in a low dose. A dose higher than 20 mg, it is recommended to pump and discard the breast milk during the first 4 hours after the ingestion. Methotrexate, methylbromide should be avoided during breastfeeding. HCQS or sulfasalazine are comparatively um, compatible with breastfeeding. So very importantly, what we stress on patients would be that the medications that you are given has to be monitored even after the course of delivery. So the baby and the mother is kept safe. During the course of breastfeeding, what happens because of the constant change in position and holding the baby for the first few months, especially when the position is not too, it's not very easy for both the mother and the child. She has to change her position and see what is best for the mother as well as for the child. So during that course of time, it becomes vital for the mother to change her medications when there is aggravation of pain. So this is about arthritis and its impact on a woman. So I would like to brief again on the entire course. Arthritis, an immunological disease affecting numerous systems. Females are the ones who are commonly affected and predominantly in the reproductive age group. Pregnancy alters the immune state that has an impact on the course of many autoimmune illness, including rheumatoid arthritis. There is no go for it. It is observed that there are 2 to 5-fold decrease in the development of symptoms and flare of arthritis in a woman. Now, especially our pregnancy and RA severity, especially in the last 3 months of pregnancy, that is the third trimester, the symptoms significantly reduce. In addition, more than 3/4 of the pregnant patients with RA show a significant improve in the first and the second trimester of pregnancy. However, the improvement in the condition may be temporary, and the flare post-delivery must be something which is supposed to be looked for. 90% of the women with arthritis develop a flare of the condition along with the rise of rheumatoid factor titers within 3 months after delivery. I repeat, 90% of the women with RA develop a flare up of the condition along with the rise of the rheumatoid factor within 3 months after delivery. The risk flare up remains for around 6 to 9 months after delivery. A flare up may be more common in a woman in breastfeeding. Furthermore, patients with no arthritis before pregnancy also may be at 5 times higher risk of developing it post-delivery. While the 3/4 of all patients show some improvement in their symptom during pregnancy, around a quarter of a patient may continue to have an active, and some of them may even have worsening of the condition. And apart from that one, many patients ask, why is there that there is a flare? What is the pathology behind the flare up after delivery? After delivery, there is a risk of flare up of arthritis. This could be because of the decrease in the anti-inflammatory steroid level and other elevated hormones, which could be having a positive impact on pregnancy. Further, there is a change in the Th2. There is an entire immune panel which is working behind, especially when there is a pregnancy for a pregnancy outcome. So there is a change from Th2 to helper Th1 cytokine profile after delivery, and that could be one of the main reasons why it flares. Now, the effect of RA during pregnancy, most women with RA have an uneventful and a safe pregnancy with no significant complications. So I can tell my arthritis patients, do not worry if it is under control and if you have conceived in a very inactive form of a disease and your inflammatory parameters are well under control, I am not expecting any major complications in you, and you will be routinely followed up as other patients. Obviously, I will keep keeping a check on the growth of the baby, the interval growth, and the Doppler as and when the pregnancy progresses. There is no effect of the condition on an unborn child. This is another question that mother asks. Because I have arthritis, will my child get it? No. Further, having RA does not affect fertility in a woman, but the activity of the disease and the medication she is consuming does have a role to play. There may, however, be a decrease in the section, right, because of the pain, dysfunction and release of the ovum or the egg, which I've already explained to you because of the alteration in the hypothalamo-pituitary gonadal axis. The management of RA during pregnancy is very vital, and most of the patients, as I said, in pregnancy, there will be a reduction, but if there is a flare, there is supposed to be change of medication, which has to be actively done. Long-standing inflammation and an active disease has a negative impact on the growth of the baby. So this is about arthritis and pregnancy. We will be continuing with the same session next week in Kannada. So kindly log in, and if there's any questions, mail in to us so we can get back to you with the queries of the same. Thank you.